you have an urgent care center there. There's no hospital there. You have to fly out of there. Flying out of most places.
How much would it cost for a flight, taxi, or something like that to take you?
Between $5,000 and $10,000
for a private plane to pick you up as an emergency. Healthcare in Costa Rica is fucked. And in this video, I have with me Jhonny Humana. He's a professional in healthcare. He helps a lot of people when they have to come and they need medical
Pablo,
attention.
they're not fucked. They're royally fucked.
Hold on.
Okay?
I'm gonna let you drive because you are the person who I'm going to interview you. So I want you to be on the wheel. So you guide us wherever you want to drive, and let's talk about this. Are we fucked? So while we're changing seats, don't forget to like and subscribe. And if you need anything about shipping abroad, I'm your guy. Here I go. Let me put my seatbelt because I don't know how good of a driver you are. I see you with those glasses. Man.
You know what? How you doing, brother?
Thank you for coming to our channel.
You know what? It was a pleasure to be here. Let's talk about getting unfucked.
I started this video saying that it's drive. Yes,
it's drive.
Okay, it's drive.
Okay.
Like they bring yourself.
I know it's different than driving Costa Rica, right?
I started this video saying healthcare in Costa Rica is fucked, and a lot of the people who are looking to move to Costa Rica may be they may be thinking, and go to Costa Rica. They have such a great healthcare, which we're known among Latin America for good healthcare. It's supposed to be one of the best. The country invests millions.
Pablo, we're in the business of making money. It's not about healthcare.
What do you mean?
That's what healthcare really is.
What do you mean?
It's about making money. You know what? Making money in healthcare is that sometimes you're focusing on people thinking, you know what, that the healthcare system is supposed to all the time take care of you. And it does to a certain point. But it is a business. They're not into you to being healthy all the time. They want you to be sick sometimes, right? Have you?
That's a reality. Now that you're talking about it, and I can think about the screw up of the COVID-19 vaccines, kind of like push a vaccine to globally. Now that you're saying, of course, it's a business. That was a business. COVID-19. I don't know how many millions died, and it was a huge business for the pharmaceutical industry. And in Costa Rica, we get these vaccines, let's say, for free, but the government pays millions for this.
Of course, yeah, but it was also an aspect of how do you control healthcare, and everybody in the world listens to you. Wasn't that amazing? How you got every country in the world not fighting, not going to war, but yet we stayed in our homes because there was I'm buying
fucking paper mask and vaccines.
Yeah, it was kind of cool that you controlled a whole cultures from one end to the other end, and some people didn't even participate, and they got along with everybody.
But let's stay focused here, and let's just go back to like Costa Rica. So it's a business that you're saying. So we're not fucked. It's just the way it is. It's a business.
It's a business, but you got to take care of yourself too, Pablo. When's the last time you went to the doctor?
A few months ago, I guess. Okay. I did a checkup.
You went a few months ago. What does that mean? That means that we put the burden on the doctors and the system to keep us healthy, but we don't put our own effort into being healthy. That is a problem, and one of the reasons why people move to Costa Rica is they expect that we're going to be a little bit healthy, but they bring back the same habits that they had from where they came from. They don't eat correctly. They don't go in and try to change their habits. I want to have what I have at home. I want to do, and I just want to take a pill that everything goes away. It's not a way to be healthy, but we blame the system, right?
Yeah, but at the same time, I understand the habit part of it, and we should all be healthier and have better habits. And of course, if you're moving to Costa Rica, you should use this opportunity to get new habits, to get into the habit of eating healthier, less processed food, healthier, and maybe more movement. And that's good. But at the same time, what if I'm moving to another country expecting the healthcare system to be better? I mean, some people could just pick to move to another country, and this is a lot of our customers and audience and friends who we having moving to Costa Rica. That's at least the expectation is, okay, I'm moving to a country where I can feel secure if something ever happens
But
to me.
Pablo, who has control over that? You do. You have control over what you put in your mouth, what you buy, where you go, and also where you shop at. If you take all these things in consideration and you start living and trying to practice better practices when you get here, you're going to have a better healthcare system. You're going to have a better response. You're not going to rely so much on somebody needing to take care of you.
All right. So what you're saying is the healthcare system in Costa Rica is perfect. That's what you're saying.
I'm saying that the healthcare system in Costa Rica is not perfect.
No, you didn't say that.
No, but you know what? I did say it because the system is not. It shouldn't be around what the country is. It's about what you were doing. In Costa Rica,
I mean, what about some people just have some condition, regardless of what they do on the day-to-day life, on their day-to-day lifetime. Some people maybe they have diabetes. Diabetes? Am I saying?
diabetes.
That's of course they need to be healthier, eat better, all that. But that's something that's a condition that will be there potentially forever. It's really hard to reverse.
Where do your customers move to right now? Where do
would they move
to?
to Costa Rica, or would they move to Spain or a country in Europe?
You don't need to move to a far off place to find good health care. You need to be closer to the towns and the cities that have a higher concentration of population because there's more resources.
Okay.
Here in Costa Rica, the farther away you move from San Jose, the less resources you have.
Okay.
Let's give you an example of Guanacaste.
I want you to be very loud for the mic.
Look, Guanacaste has a great system, right? And you know what? There's a lot of people that go there, but their system is based on a false narrative of that you have this urgent care there. Urgent care is great, but if something happens to you, very serious, in Guanacaste, you only have so many options to go to.
Now let's talk about that. What are the options that somebody has if they need to get a serious clinic or hospital? What are the options for Guanacaste?
Well, it doesn't matter what your income level is or if you're poor or rich, if an emergency happens and it happens to be closer to a public facility, the public facility should be one of the ones you go to. In Guanacaste, you have Liberia Hospital. But consider this, Liberia Hospital is a level 2 hospital. It is not a level 3. And also knowing who is on staff to be able to handle that type of responsibility, because you don't always have enough people to respond to a major situation. So, and then on the private side, you have some urgent care clinics that can stabilize you, fly you to San Jose, or you have too many hospitals that can take on minor stuff but don't have enough staff to sometimes intervene or call on to somebody. You don't have that type of time.
Okay, I have a question. If you are a newcomer, just move to Costa Rica or think about moving to Costa Rica, what is the best advice you can give them so they pick the right location for their particular case and they can get good treatment in case something happens?
Well, one of the things that if you come as a couple is create an emergency. What happens if, Pablo, you have an emergency? Where am I going to go? Without Waze, okay? Without Waze.
What do you mean?
Well, Waze.
Without Waze, the map.
Waze, the
map or Google Maps.
Yeah,
okay.
right. Without knowing, hitting Waze on where the closest hospital, you create an emergency and you partner that usually doesn't drive.
So the advice is create an emergency plan. Is that what you're saying?
Yes, create an emergency plan on what you're going to do, what you want, if it's serious, what your loved ones should know, what to do. Do you want to be resuscitated? Because Costa Rica, by default, will resuscitate you if you pass.
Okay.
Those are the things creating a plan is one thing. The other thing is putting yourself in a situation. If you have chronic conditions, staying closer to the greater metropolitan area as a first resource.
So basically, if you know that you have a condition that you may need to get treatment once a year or whatever, if that's a possibility, don't move to Puerto Viejo de Limón, 6 hours away from San Jose. Don't move to, like, I don't know, Drake Bay, Drake, or Drake Bay, whatever. Don't move to Guanacaste, I don't know, Nosara, Guanacaste, which is like as remote as you can get.
Nosara is as remote as you can get.
It's beautiful, but
It's beautiful, but you don't have.
you don't want to die in Nosara.
No, you have an urgent care center there. There's no hospital there. You have to fly out of there. Flying out of most places.
How much would it cost for a flight, taxi, or something like that to take you?
Between $5,000 and $10,000
for a private plane to pick you up as an emergency.
Yes, because when it becomes an air ambulance, all the fares triple in price, and you become an issue to bring. You get the most. It costs too much. It really costs. But if you have heart conditions, I would not stay too far from GAM to understand what your resources are.
Okay, well that's amazing. Thank you so much for the advice. We're gonna put Jhonny's YouTube channel and link below. And Jhonny, just lastly, how can people reach out to you, and what is it that you do for your customers?
What we do is we provide a sincere plan, a personalized plan on how healthcare should be managed for you in Costa Rica. Help you if you do get into a situation that you do need assistance, to guide you through the medical processes here, how to get in or out through hospitals, how to arrange physicians that have been qualified to handle your situation, but also to give you that peace of mind when we do things at Green Healthcare Costa Rica, that you know that it's not just somebody selling you something or selling you a solution. It's saving your life.
It's something that you plan with them.
You plan with them ahead of time. You prep people so when they come here or they have a situation, they know how to react. They know how to do things. They know how to ask. And Pablo, the most important thing is practicing the 3 B's. Buenos dias, buenas tardes, y buenas noches.
Like that.
That is the 3 B's that you have to know with healthcare or anything in Costa Rica, because courtesy will get you a lot further than complaining and bitching about a service that you think that you're not getting because a person gets mad.
And how people can reach out to you?
They can reach out to me on my Jhonny Knows Costa Rica channel. They can go to my website, greenhealthcarecr.com. or they can email us at info@greenhealthcarecr.com.
No, just go ahead and park right here. I'm afraid of your driving, man.
You know what? This is so wrong, Pablo.
I'm sorry. I'm freaked out.
All right, brother. Thanks for your time with me.